All right, welcome to this explainer all about travel health. We're going to give you a really solid, efficient framework for handling those pre-travel consultations right there in your pharmacy. The goal here is to help you take what might start as a simple question from a patient and turn it into a really thorough and honestly a potentially life-saving conversation.
Okay, so here's what we're covering. First, we'll talk about your role in travel health. Then, we'll get into the pre-travel risk assessment, super important. After that, preventing bites and illness. And finally, we'll wrap up with how to properly equip the traveler for their trip.
So let's start with Section 1, your role in travel health, and really establishing the need. Look, in today's world of, really complex travel, you are often the most accessible healthcare professional a patient sees before they leave. That puts you in a unique position, and it makes your intervention absolutely vital. 488. Just think about that for a second. In Canada, that's how many travel-related malaria cases we see on average every single year. And this isn't just some abstract number on a slide. Each one of those cases represents a person, a potentially preventable and life-threatening illness. It just goes to show how high the stakes really are for travelers who aren't prepared. And it really highlights the huge opportunity you have to step in before they even zip up their suitcase.
And, the risks are out there for pretty much every kind of traveler these days. You'll see it with an aging population, folks traveling with more chronic conditions. People are also going to more remote places than ever before. And there's this false sense of security people get at resorts. But a huge one for you to watch out for is the VFR traveler. That's people visiting friends or relatives. This group is notorious for having riskier, last-minute plans, and they almost always skip the formal travel clinics. But you can bet they'll pop into your pharmacy for some last-minute advice.
All right, on to Section 2, the pre-travel risk assessment, which is all about asking the right questions. This is really the foundation of any good consultation. It's how you take a simple, "what should I pack?" and turn it into a truly personalized health plan for your patient.
So when you're sizing up the situation for a patient, it really comes down to two sides of the same coin. On one side, you have the intrinsic factors. This is all about the traveler themselves, their existing health conditions, what meds they're on, their vaccination history. Then, on the other side, you have the extrinsic factors. This is everything to do with the trip itself, where they're going, for how long, what they'll be doing. Nailing the interplay between these two is absolutely key to giving targeted, effective advice.
Okay, so this right here, this is basically your essential checklist for every single travel health talk you have. These items are non-negotiable. You absolutely have to know their destination, how soon they're leaving, what kinds of things they plan on doing. And of course, you need an up-to-date vaccination history and a complete list of their current medications. Getting the where, when, and what of the trip, plus their health status, that's how you get the full picture of their risk.
All right, moving on to Section 3, preventing bites and illness, the proactive approach. So once you've got a handle on the risk, your job kind of shifts. You go from information gathering to proactive education. This is really where you empower the patient with the know-how to protect themselves out there.
And a big part of that starts with this core concept, the vector. Now, a vector is just any organism, think mosquitoes, ticks, fleas, that can transmit a disease from an animal to a person or between people. Understanding this concept is what lets you explain why avoiding bites is so critical. It's not just about an itchy spot. It's literally about breaking the chain of disease transmission.
Now, this table is a fantastic little cheat sheet for your patient counseling. But the real game changer here is that active time column. Check it out. The Anopheles mosquito, the one that carries malaria, is most active from dusk to dawn. But the Aedes mosquito, which carries dengue, chikungunya, and Zika, that one's a daytime biter. See how important that is? This one little detail completely changes your advice. It's not just wear bug spray. It's you need to be on top of your repellent all day long, and you need to make sure where you sleep is secure at night.
So, when you're talking to your patient, you can break down bite prevention into these 4 simple, actionable steps. It's like a layered defense system. The first 3 steps are all about creating physical barriers, sleeping in well-screened rooms, using a proper mosquito net, and wearing protective clothing. Then, step 4 is that final layer, the chemical barrier, applying a good Health Canada recommended insect repellent.
Okay, last section, equipping the traveler, the first aid kit and key medications. This is where we move past just giving advice and start talking about the actual tools. Empowering your patient to handle common problems on their own? That all starts with helping them build a really solid first aid kit.
Honestly, a well-stocked first aid kit should be non-negotiable for any traveler, and this slide is the perfect checklist you can go over with them. Notice how it's not just about Band-Aids and gauze. It covers the essential oral and topical medications they'll need for the most common travel ailments. This is how you make sure they're ready for a minor issue before it has a chance to turn into a major problem.
And here's where your specific clinical knowledge is just so critical. Take this pearl about analgesics. You know a patient is going to grab something like ibuprofen or naproxen for aches and pains without even thinking about it. But your advice to avoid NSAIDs in areas where dengue is a risk is absolutely vital. That one piece of counsel could literally prevent a serious, life-threatening hemorrhagic complication.
Here's another great one, this time for antidiarrheals. When it comes to traveler's diarrhea, which is, let's be honest, super common, your advice can make a huge difference in their trip. Making it clear to patients that something like loperamide gives faster relief and can be used right alongside antibiotics, that's how you help them manage this incredibly common issue with confidence.
And for our last pearl, let's talk insect repellents. This is a classic more is not better scenario. So many patients just assume that a higher D percentage means better or longer protection. Your guidance here, pointing out that anything over 30% doesn't really add more protection time but can increase toxicity risk, that is crucial. It helps them pick a repellent that's both safe and effective, which is an especially important point when you're counseling parents about what to use on their kids.
So the question is your next patient going to be prepared for their journey? When you use this kind of structured approach, assess the risk, teach prevention, and equip them properly, you can feel confident that the answer is yes. You're doing so much more than just dispensing. You're really stepping into that vital role as a key part of their healthcare team, making sure every traveler that walks out your door is ready for a safe and healthy trip.